Tim's Pain-Free Podcast. We're here for our 4th episode. Really excited today. Is our first guest going to be on the show with us today.
That's right. It's not just going to be me and Daniel.
Yeah, that's right. So what are we going to be talking about today, Dr.
We're
Tim?
talking about chiropractic and all things chiropractic.
Chiropractic, how to get started.
Yeah, well, chiropractic actually started back in 1895 officially. The first chiropractic adjustment was given by a doctor named D.D. Palmer. It was in Davenport, Iowa, and he adjusted actually a man named Harvey Lillard who had been deaf for several months because he had had an accident, and he was a janitor in Dr. Palmer's facility, and he knew that he was deaf, and he saw him bend over one day, the story goes, and he noticed that a vertebrae was out of line in his spine, and he said, through an interpreter, talking with a deaf man and even writing it out, hey, I want to try something on you. I want to put this bone back in a better position. And he adjusted him, delivered the first chiropractic adjustment, and Harvey Lillard could hear. And so at that time, D.D. Palmer thought, what have I done? I've caused someone who can't hear to hear. And he had been trying to prove this theory that became known as the subluxation theory, that when any bone is out of a line in the spine, it causes just enough pressure on the nervous system, and that wherever those nerves travel to in the body, that there's going to be some sort of, that interference causes a problem, right? So if the bone's out of position, it could cause a problem somewhere else in the body, like a referred thing. And so he was trying to prove that, and then this kind of set it off and set the ball rolling, so to speak. And, by 1896, together with a pastor that he knew, a preacher, his name was Sam Weed. He knew some Greek from studying the Bible, and he came up with the phrase chiropractic. Okay. And chiro in Greek means the hands only, and practic is to do or to practice. So it became chiropractic. He said, well, what you've done on that guy is some chiropractic. And D.D. Palmer ran with it. And by the next year, 1897, he had started Palmer College of Chiropractic in Davenport, Iowa, and started training others on this subluxation theory and how to reduce that subluxation. So a subluxation is defined as less than a complete dislocation. So a subluxation is not like when we dislocate a shoulder and it's out of its
dislocation.
Joint. Yeah, that's a dislocation. Subluxation is less than that, but it's enough of misalignment and out of its normal position to cause a bunch of other things to happen. And so the story goes that by 1920, D.D. Palmer had a son named B.J. Palmer, and so D.D. Palmer was kind of known as the founder of chiropractic. Well, B.J. came along, and he was the developer. He really pushed it mainstream, got the school going really well. He actually bought radio stations in the 20s, and the radio station's sole job 24 hours a day was to promote chiropractic and to sell it, to tell the world that we're fixing people just with our hands. And so 1921, this famous pathologist came along. His name was Henry Windsor. He's a medical doctor. He had the means to actually debunk this whole theory. So he started...
And the theory, the subluxation theory, right? Basically, your brain is connected to all parts of your body through the nervous system.
Correct.
It comes out of your spine.
That's right.
So something that's not in proper place in your spine is going to be interfering with something.
That's
some function
the whole subluxation
end.
Theory.
Gotcha.
And so this Windsor came along, Dr. Windsor, and he said, that's hogwash, and I'm going to prove it. So he had the means and the ability to, being a pathologist, he did over 75 autopsies, whole body cadavers. He would get the cause of death. The cause of death may be liver failure or kidney disease, and the person died. So he cut them open and he found the diseased organ, and then through his dissection, he traced the nerve that oftentimes was withered, and he would trace it back to the spinal cord level, and he'd say, aha, it's pinched. That's why it's withered. So he'd have one healthy kidney on the left in a patient with a normal sized nerve, and the other nerve would be all choked and irritated and dried up, going to the dead organ. And so his conclusive findings at the end of all this study in 1921 was that the subluxation theory actually did exist. He proved it instead of disproving it. And he said that the more serious the pressure and pinch on the nerve was, the more damage was seen in the end organ. Okay, so that's how chiropractic actually got started. It was reducing the irritation, inflammation, pressure, interference at the nerve level, which is in the spine, and it would cause all these other organs to work better, and so that's how it got the ball rolling.
Yeah, so
in
it
chiropractic.
it was working on the nervous system in general
Right.
at the beginning. Now that's not the general population's thought, though. I mean, you're a back doctor, right?
That's right.
How did it go from this nervous system to the back doctor?
Well, it's interesting because we are known as back doctors, as chiropractors now, and I believe honestly that it's because when God created man, He put the brain and central nervous system in the center, and He put it in their spine. So we were working on the spine always. D.D. Palmer and B.J. were working on the spine to affect all these other organs, but it kept going back to the spine because that was the source. And so, I jokingly say, if God would have made our nervous system in our arms, 100 years later, 120 years later, chiropractors would be known as arm doctors instead of back doctors. But, it's what's interesting is, this is our pain-free podcast, and we're talking about pain and how chiropractic can help pain. But it didn't start that way. So how did it get to where now we're just kind of related to pain? Well, again, the research then in the 20th century, in the 80s and in the 90s, without a doubt emphatically proved that the best treatment for back pain was the chiropractic adjustment. So when chiropractors now say, well, that's the low-hanging fruit, that's my bread and butter, that's the easiest thing I can do is work on someone's back and reduce their pain. But what's interesting is it still comes back around time and time again. Patient after patient will say, you know what, I came in here because my back hurt, and then just after a few visits my back pain started feeling a whole lot better. And interestingly enough, this symptom, restless legs or insomnia or having blood pressure, high blood pressure, or a symptom like indigestion or one of these other symptoms.
That's my story,
That's
my story. Yeah, I took Provocid. It's an antacid. Took it for 10 years, every day of my life. I would have heartburn by 9 o'clock in the morning if I didn't take it. And then I started working here, started getting regularly adjusted. Haven't taken it. Don't take it anymore. Where my pain, I came in with pain like most people, mid-back pain. But then after several adjustments and regularly staying up with it, I don't take that medicine anymore. I don't have heartburn.
So it had an effect on the system within the body and the organs as well as the pain.
That's right.
Well, that's the beauty of it, because those stories still exist. They still happen on a regular basis, and we're not the kind of clinic that's out there really pushing the subluxation theory agenda forward, but we do see it and we realize it, and all chiropractors are trained with that deep-rooted philosophy that the central nervous system controls everything. When you look at the development of an embryo in utero, when it's first formed, when the sperm and the egg get together, the very first thing that forms within days is the central nervous system.
Yeah,
brain. You can do a sonogram and see a brain and spinal cord before you see anything else. It's because that's the master system that controls every other system in the body. And so if you can see that if there's interference, it's like, the example I always tend to use with patients is it's like the garden hose that's running out, dripping water constantly on a tree out in the middle of a field in a hot Texas summer day. It doesn't get rain, so it's got to have a little supplement. The farmer puts a little hose on it and drips a little water. Well, if you come along anywhere in that process and you set a big old brick down on the garden hose, the end result is what?
The tree's going to die.
The tree is going to die.
Yeah.
Or even if you put the brick way up by the faucet,
right,
where the spigot is.
Yeah.
The end result is it didn't get way out to the tree. And so we all know in that case, how do you fix that problem if you're a farmer?
Get the brick off the hose.
You remove the brick.
Yeah,
exactly.
You can fertilize that tree, you can hug it, you can trim it back, it's going to die.
That's right.
Until you get that brick.
You can do all those things. And so a lot of times, that's one of the arguments is that the chiropractors say we do things with our hands only and we don't use drugs and surgery. And oftentimes, that opposes maybe some of the allopathic medical doctors' way of thinking. They want to give you a symptom reducing pill. They want to give you a pill that changes the effect of the organ. But if the organ's not working at its maximum functioning capacity, then it's a hopeless case. It's like you said, it's like fertilizing the ground around a tree that's not getting any life flow.
Yeah.
It might make it green for a little bit.
It's going to die.
That pill might make your labs change for a little bit, but if you don't fix the problem and get to the root cause, then you're going to be on a pill forever. And we're not really all about trying to medicate the world. We've already talked in episode 2 about the crisis of medication that we take in this country. So, that's where we're at with chiropractic now. We're kind of known as back doctors, and that's what gets people coming in. But what keeps them coming in is when they see the other areas of their life actually begin to be affected by getting the interference removed.
Yeah, getting the energy flow back.
That's right.
Yeah.
So that's chiropractic in a nutshell. And we're going to talk a little bit more about specific ways it's affecting pain and how it's going to treat pain in the next segment.
Yeah, I'm really excited. We're going to have a great guest here with us today. We've got Dr. Monte Nocus here with us. He's the treating doctor here at Trinity Integrated Medical. I'm sure he's familiar with all of these areas that you're discussing here with me. I love learning about it. So thank you for joining us here on Dr. Tim's Pain Free Podcast. We'll be right back.
Thank you for joining us on Dr. Tim's Pain Free Podcast. As a reminder, this podcast is not intended to diagnose or treat any medical conditions.
Hey, Dr. Tim back here at Dr. Tim's Pain Free Podcast. I'm super excited to introduce our very first guest. You might get tired of listening to just to me and Daniel all the time, so we brought in another expert here. This is Dr. Monte Nocus. He's a chiropractor. He's been in practice for the past 25 years, actually, in Kentucky, and he was raised up in Indiana. I'm going to let him tell you a little bit more about himself. But, you were raised in Kentucky. You were raised in Indiana, but then you moved to Kentucky to practice, and now you're in Dallas. What brings you down to South?
Well, it all came about through my son. My son plays for the Developmental Academy at FC Dallas, and my wife and him have been living here for a while, and it just all ended up transitioning that way. And so I ended up selling my practice and moving us this way so the family could be together and we could keep everything intact.
So he's a soccer player.
Yep.
And a pretty good one at that, if he's a part of FC Dallas.
Yeah, he does okay.
That's pretty exciting. Well, tell me how you started out to become a chiropractor.
Well, like most chiropractors, it's personal experience. Something happened that led me to that. And grew up in Indiana, and almost all boys in Indiana, boys and girls in Indiana, play basketball.
That's right.
And
the Hoosiers.
Yeah. So my freshman year in high school, out playing basketball, and went up for a rebound, and someone undercut me, and landed on my back, kind of jammed myself up, jammed my neck up. And had some stiffness and soreness, and it seemed like it just progressively got worse. And 2 or 3 weeks, I was having headaches every day. My parents noticed how much aspirin I was taking, and my dad played racquetball almost every day. And his playing partner that he played racquetball with was a chiropractor. So he was talking to him about it one day, and they said, well, bring him in, we'll check him out, see what we can do. And so I went in and did some x-rays, and treated me about a week, and all of a sudden the headaches were gone. I noticed I was starting to feel a little bit more mobility and feeling better, and as he started to get me doing some exercises, it all pretty much went away. And as I was thinking about what I was going to do that time, and most people, junior, senior year, you're thinking about what you were going to do. And I always thought I was going to have a medical background, and I was thinking about orthopedics or something like that. And that was just had such an impression on me. I kind of just cleared all that out and said, this is the way that I'm going with it.
Wow.
So
that's
how I got started.
It started with pain, though. That's kind of what initially got you in.
With a pain and a problem that I couldn't figure out and I couldn't get to go away.
So in just a few treatments, he was able to reduce your pain enough, and then he gave you some things to do to kind of facilitate even more of the healing. So how is it that chiropractic can actually fix someone's pain? How is it that chiropractic works in that way?
Well, pain's a funny thing. There's a lot of different things that cause pain. So when we have a patient that comes in, the first thing you got to figure out is what is the pain coming from? Is it structural? Is it a joint pain? Is it a muscular pain? Is it a fascial pain? Because when we have an incident, when something happens, whether it's a fall or just something as easy as bending over to pick something up, a whole trigger response happens, and it's a neurological response. And the pain is basically an alarm system saying something's wrong, stop doing that.
That's right.
And then everything around it grips down, and almost like a natural cast to keep you from doing what you're doing and put you kind of in a fight or flight sensation to stop injury from happening further.
Okay.
But a lot of times what happens with this is it's kind of like Groundhog Day. Did you ever see Groundhog Day?
Yeah.
Same thing happens over and over. And what'll happen is whenever an incident like that happens, the neurology of it just doesn't happen and then shut down. It'll sometimes get into a loop and keep recurring over and over, so that you get more chronic muscle spasm, fascial tightening, and pain, and then it's just a vicious cycle that continues on after that. So you can have a pure pain, which is from a nerve, maybe from the joint or the nerve, which has a real delineated pattern that comes down through, or you could have the pain coming from the receptors in the muscles or in the soft tissue or fascial connections, which give you real diverse types of pain that could go anywhere. You could have, something in your trap that you could give you pain in your head or in your jaw or out into your arm. And deciphering those things and figuring out, do you just have one of those or do you have a layering of them? Sometimes you can have a fire sitting there burning and people squirting lighter fluid on it. It makes the fire extremely big and extremely hot. Well, same thing with this. You could have one problem or you could have multiples of those problems, and you got to figure out, is it one or is it a bunch of things sitting there squirting lighter fluid on the fire, creating more problems as you go.
Yeah, that makes sense. And regardless of the type of pain, most people are reaching for a bottle of pills and just living off of decreasing the symptom of pain, but they don't really know the cause. So getting to the cause seems like that's one of the most important things you do as a chiropractor, is trying to differentiate it. Is this from a pinched nerve or is it from a spasm in the muscle, because it's happened so many times that it's chronic?
Right.
Yeah. So what do you do to as a chiropractor specifically with your hands to help fix these problems?
Well, the biggest thing is finding out the combinations of what you're doing, and if the joint is stoved up and locked up, you got to get it moving again. So you can use various different things. Some people really like to be manipulated. They like to hear that cracking. They like to hear that the joint moving and changing that dynamic. Some people don't like it. So number one, you got to figure out what's best for them. Is it using an instrument? Is it something really mild? Is it doing a full-on normal chiropractic adjustment that you would typically do? Mm-hmm. It's got to be tailored to the person. They have to be comfortable with it.
Yeah.
So first and foremost, mobility, getting things moving. Motion is life, keeping things moving. Number two, dealing with the soft tissue. If you have fascial tightening, it spreads out like spider webs throughout the whole body. So you might have pain in one area that is actually being caused by fixation or fascial tightening in another area. So you have to look peripherally. You have to look where the problem is, but you have to look above it and below it and around it to make sure that you're getting all those different types of things. So the second thing you got to look at doing is loosening those areas and balancing those out. And then any muscular dysfunction that you have because of that, if it's caught in one of those Groundhog Day loops where it just keeps going and going and going, you've got to affect it to kind of reset and get that muscle calming, get things moving and pulling evenly and dynamically again. And as you build that balance and coordination and stability and postural integrity, that allows things to start to normalize and become more consistent with the way that it was before it was injured.
Fascinating. He definitely knows his stuff. I don't know if you're listening to all this and catching what he's saying here, what he's dishing out, but he's an expert. One last question I want to talk about is, people have said to me as a chiropractor, well, once you go to the chiropractor, you got to go the rest of your life. Or they say, the chiropractor, they're going to always find something wrong, because every time I go in there, my neck cracks super loud, so I'm always off. And I feel like I'm always off because you can always put me back in, and that pop sound next to the mic there, that's what they're feeling in their spine, and they're feeling good after it. But are there different types of care that a person goes through, or is it pretty much about just pain relief in your experience?
Well, that do you need to keep coming over and over and over again? That's kind of a double-edged sword. Easiest way to explain that is it depends on you. If you come into a situation and come into the office and you've got an acute pain, but you've got a chronic problem like a degenerated joint, a degenerated disc, that's your weakest link. And if you stabilize and do everything needed to get that back to where it needs to be, you've got to continue to maintain and do things on your own. If not, you're going to gradually work your way back to that anyway.
That's right.
If you've got an acute injury, it's typically a chronic problem, a degeneration that's just got to the point where it's kind of the straw that broke the camel's back, and then you became symptomatic at that point.
That's right.
And so for those, do you have to keep coming, and will you need maintenance? Yeah, you do.
Sure.
And there's no way around it. Now, you may not need to come super frequent, you got to figure out what's the best for you and your condition, and how well do you continue to do the things on your own that you're told to do, stretches, flexibility, exercises, and those type of things. But for those instances, you do need to maintain, and it is a thing where it can slowly degrade. So you've got to constantly keep it up to its maximum efficiency so that things slow that process down as much as possible. Now, if you come in and got an acute injury or something like that, you have no underlying problems, no degenerations, anything like that. All you need is an acute care plan, get you back structurally sound and get you stabilized and make sure that your core is strengthened and everything's there, which could be a matter of a couple of weeks or a matter of a couple of months. But at that point, you're done unless you have another incident or another injury or something like that.
Sure.
So it depends. It depends on that. And but it would be almost an injustice to tell you don't ever need any more care if you've got a degenerative change that does need to be maintained at some point.
Right.
So we're always going to tell you exactly what you need, and then it's up to the person to decipher what they want at that point.
That's right. And I from my experience, sometimes the chiropractor gets a bad rap because they are kind of known for someone who educates people in this way, like you so eloquently put it. But in reality, you'll never go to any doctor that you could ever find, no medical doctor, no general practitioner, not even a dentist, that'll tell you you never have to come back and see me. That's just not the way it works. As long as you got teeth and want them healthy, you go to the dentist. What for? For a cleaning. What is a cleaning? It's kind of like a maintenance visit. It's a routine check to say, this is going to get bad, we better catch it before it gets bad, or you're already in bad shape and you just haven't had the symptom of pain yet, right? And so, it's like the check engine light popping on your car and you're driving down the road. You don't just cover it up with a pill or a piece of tape and keep on driving and think you fixed the problem. You get it checked out. But that check engine light could be for it could be that you haven't maintained your car very well at all, and that you also threw a belt and your compressor's not working to push the cold air into through the vents. It could be all those things, but the only indication is that check engine light. So the indication in your body may be pain, but it's coming from years of neglect. I can't tell you how many times I've had patients come in and say, no, this is not a long-term problem. I literally bent over yesterday and the back pain shot just yesterday. And then I take an x-ray and we look at their spine and they got 30 years of deterioration and degeneration, and we got to look back and say, what did you do back as a kid? Or, oh yeah, I used to ride motorcycles and I crashed it a dozen times. And I'm like, well, when you bent over and picked up the newspaper yesterday, it didn't happen to weigh 400 pounds just yesterday out of all the days that you pick it up. It's the final straw that broke the camel's back. And so this has been fascinating for me. It kind of gives a great fresh perspective on the different types of pain and the importance of coming up with the proper diagnosis of where that pain actually is originating and coming from, so that you can do the true things that fix it. Here at our integrated clinic, chiropractic is a major part of it, because I'm a chiropractor and I'm the owner of Trinity Integrated Medical, and I started out years ago being a chiropractor without all these other things that really are designed to be brought in to help patients with all the different types of pain. If they have strengthening issues or weakness, we can work that with some therapy. If they have trigger points in the muscles and the fascia and all those things have laid down scars for years, you probably could do pretty good work with your hands as a chiropractor, but you could facilitate that healing much quicker with those trigger point injections that we talked about in episode 3. All in all, our goal and our mission here at Trinity Integrated Medical is to make sure that patients aren't just getting the obligatory prescription for a pill, go home and take this and everything will be okay, because that's not really fixing their problem. And we want to avoid surgery. Not only are they costly, but they take such a toll on your body, and there's actual diagnoses now in the ICD-10 code books that say failed back surgery syndrome. So if you can be diagnosed with a failed back surgery, we want to try and avoid that, right? So those are all the things that we do here to make us integrated, and chiropractic is a huge part of that. And I want to thank Dr. Monte for being a part of our podcast today. If you're seeing this video and you have not yet met Dr. Monte Nocus, the newest addition to our team here at Trinity Integrated, I encourage you, make an appointment, come by, shout out on here, write in the comment section below, come in and get a once-over from this guy, and your life will never be the same. He's got incredible hands. So thanks for coming out, and we look forward to you tuning in for episode 5 next week. But that's it for today. Take care.
Dr. Tim's Pain-Free Podcast is produced with you in mind. We are on a mission to better educate the world about living a pain-free life without drugs or surgery. Help us by spreading the word and sharing this podcast. Thanks for listening.